Hello, I'm Michael Pierce, and this is The Human Condition. Today we're talking about tips and tricks for anxiety and OCD. I've been asked by you, the viewer, to talk a little bit more specifically about some of the stuff that we use for anxiety and OCD naturally. Now, please don't do these things without seeing your doctor and talking to your own advisors. But I just want to give you some idea of the most common stuff that we see as very effective and useful in helping with some cases. And bear in mind that some cases will be tougher and they'll require a lot more detailed assessment and nuance with not only diagnosis and assessment, but treatment methods. Because nobody gets sick because of a deficiency of a drug. The first thing we should talk about with anxiety is that anxiety represents an excessive worry and excessive thoughts where a person has intrusive thoughts and anxieties and feelings where they're worried about stuff and they're concerned about events that have either happened in the past or that are going to happen in the future or may not happen in the future, things they're worried about, things that might occur or might not occur, and things that already have occurred. And there's a lot of other differential diagnoses that go into this, but generally we're talking about, anxiety as being most days of the week, more than half of the days of the week, or most of the days of the week, 6 months in duration. It affects your rest and it gives you fatigue. It causes problems with sleep and it causes problems with concentration. Very often, patients can even have autonomic symptoms or sympathetic nervous system symptoms and parasympathetic nervous system symptoms. And the reason for that is that the sympathetic and parasympathetic nervous systems work together. They really do work together, and they are controlled by the same set of neurons inside of your brainstem and spinal cord. And those cells, when they overexpress themselves, often express excessive sympathetic and parasympathetic when they're at their extreme range. And since anxiety is an overfiring of the brain generally, it's not an underfiring. It's mostly an overfiring, although there can be some underfiring regions. What you get is a mixed expression that looks a lot like autoimmune thyroid disease. Because autoimmune thyroid disease also gives you over metabolic firing and under metabolic firing, so you get confused. So you might be confused because you'd think, well, I've got hot flashes, I've got sweating, I've got dry mouth, I've got diarrhea, I've got nausea, I've got shaking and nervousness. And so all of these different things are symptoms of overfiring of both the sympathetic and the parasympathetic nervous system. Now, some of you may have been taught, as I was, wrongly, that you either have sympathetic dominance or parasympathetic dominance. And that's generally true during most of life, but it's not true at the extreme ends. At the extreme ends of overexcitability, the brain will drive both systems to express themselves. So you get a person with diarrhea and excessive urination and vomiting and nausea, which is very parasympathetic, while they're simultaneously having sympathetic symptoms, which is a cold sweat, cold sweaty palms, and rapid heart rate, and just agitation, for example. So this is the idea that you have to understand the sympathetic and parasympathetic system work together with each other, not opposite. OCD and anxiety include overfiring of centers of the brain that are fairly deep. This includes the cingulate gyrus, which is a ribbon inside your brain. When you open up the brain like this and you look at this patch of brain inside the lobes, from the frontal lobe all the way back, we have the anterior cingulate, the middle cingulate, and the posterior cingulate, or the anterior ribbon, the middle ribbon, and the posterior ribbon, front and back ribbon. So that ribbon of tissue is really the limbic system, or the emotional system, that controls and regulates your mood and how you feel, as well as your endocrine system and your immune system, with the cerebellum, by the way. It isn't just the limbic system, but it works together with the cerebellum down back here to control your endocrine system, which is your hormones, and your immune system, which is your immune cells. And we've been talking about that a lot in these days of COVID, all the different discussions about how the immune system works, how it can be strengthened, how it can be weakened. And so an anxiety state can weaken the immune system. So we want to try to strengthen the brain through chemistry means. So with these disorders, we often have to look at first magnesium. The most successful nutrient that I see in anxiety is magnesium, because 50 to 80% of Americans are deficient in the RDA of magnesium. So that means they're not getting enough magnesium from their foods. And foods occur in leafy green vegetables, and they also occur in animal foods and in organ meats. So if you're a person who isn't eating leafy green vegetables, then you either need to be eating a carnivore diet or supplementing with magnesium. So A lot of people will take magnesium in the form of leafy green vegetables, but the problem is those leafy green vegetables often are high in oxalic acid, and that gives you kidney stones, and it can give you brain problems like ADHD. It's been linked to ADHD, and it can also give you arthritis. Oxalates can give you pseudo-gout, which is arthritis of the fingers and the joints. So be aware that magnesium is very useful as a supplement to help as well all those different problems, but magnesium also calms down the brain. Magnesium helps to calm electrical misfiring in the brain. Magnesium and potassium are very important because they calm the electrical activity of the brain and bring it farther from threshold so that it's less likely to fire. So whenever you've got an excitability in your brain, magnesium and potassium are the things that are very useful to bring that down. And so is zinc, by the way. These are three minerals that are useful for reducing the electrical potential of neuron cells so that they're farther from threshold so that they are less likely to fire. So it makes it a little harder to nudge them to fire, because in an anxiety state or a bipolar state or any state with mania or a schizophrenia state where there's hyper firing of the brain cells are very close to threshold, and they have essentially what is like a hair trigger on a gun. They're triggered by the slightest local stimulus nearby. On the other hand, there are some herbs, or some minerals rather, that are very popular and very important, like calcium and sodium. And sometimes people do poorly with calcium and sodium if they have an excitable brain activity. So if you've got a brain that's very, very active and you're just one of those people that's like a cat on the roof that's just, you startle a cat and it sticks itself to the roof, that kind of imagery, if that's who you are, then think about reducing calcium supplementation. Even if you're taking it for bone density or some other problem, you can get calcium and get it from other foods. You can get it from dairy foods. You can get it from animal foods. It's very easy to get calcium as long as you have good vitamin D and as long as you have other trace minerals. So look out for other trace minerals and make sure that you've got trace minerals. I don't want to be speaking ill of calcium and sodium, but I do want to just mention that if you're taking a calcium supplement and you've like 1,500 milligrams of calcium every day, you might want to see if that's contributing to your anxiety and your OCD and your manic episodes or anything like that, because those minerals do bring the cells closer to threshold, which is not a bad thing. It's just something you have to watch out for. Now, sodium is very controversial, and when a person eats a carnivore diet, their kidneys require about twice as much sodium as the normal person that's eating a plant-based diet. And that's just normal kidney physiology. It's a requirement because of the spillage of minerals through the kidneys when you eat higher protein and lower carbs. So when people try to get heart healthy by reducing, truly heart healthy by reducing their carbs and increasing their healthy fats and animal products, they will often find that they feel terrible if they don't supplement with salt. That means they've got to salt their food about twice as much. So this means that a person that has problems with minerals because they've changed their diet or they never take minerals, they're going to have to take some salt. However, if you take a bunch of salt, hearing that salt is healthy, but you stay on a high-carb diet, you're going to give yourself high blood pressure and all kinds of problems. And your doctor's going to tell you you're an idiot for taking this high sodium because of your pre-existing blood pressure. So what we don't want to do is take a high blood pressure patient and just pour a bunch of salt into them without having some more enlightenment. So that means let's do some insulin resistance work. Let's lower carbs first. Let's give magnesium first. And let's slowly add the salt. And when you do that, it only takes about 10 days to normalize the system enough so that you can add salt without increasing blood pressure. So work with your doctor if you have high blood pressure. Work with your doctor if you take sodium and it leads to high blood pressure, because that is a reversible, normal type of condition. Don't just run away from salt and say salt is bad all the time, because that's what we do today in America, and it's just wrong. And it's incomplete. There are some essential oils that are useful for anxiety and for OCD. They are lavender and rose, and there's many more. I'm not an expert on essential oils, but I've seen them work quite a bit, and I've also seen acupuncture work fantastically. There is a traditional Chinese medicine diagnosis called liver fire or liver yang, and again, I'm not well versed in that method, although my name is Dr. Pierce. I'm not an acupuncturist, nor am I certified in acupuncture, and I don't perform it. But acupuncturists can normalize this pattern of liver fire or liver yang, which is a very energetic pattern that happens in the energy system where a person ends up just being very hot and red and anxious and angry. And for some reason, putting needles in people normalizes those meridians, and I don't understand how it works, but it's really cool, and I've seen it work. And there's no parallel Western diagnosis that I understand from chemistry or physics or biology or electricity that explains that. But I've seen it work. So I just want to say, if you've got an anxiety state or an OCD state or any state where you're really manic or you're just always on and you can't turn your brain down, think about going to get a traditional Chinese medicine TCM diagnosis and treatment from someone who's certified to do that. Next is colon hygiene. This is a controversial issue, and I like to talk about controversial issues because I've worked with a bunch of colon hygienists, and they're very well-educated people, and this gets a bad rap in the United States. It gets a bad rap even from some holistic doctors, and funny enough, my chiropractic school was down on colon hygiene when I was going there. And so it's very important to understand that even some holistic schools and colleges and universities don't like colon hygiene, but I think it can be very important when used properly, and I think it's a wonderful tool. So realize that when colon hygiene is done properly, which is to say introducing water into the rectum and into the large intestine to wash it out and do several types of things, you get some really good physiologic effects. One is you expand physically the large intestine, which stimulates the parasympathetic nervous system. Sometimes that can be helpful in people. Sometimes it can make them worse. So work with your colon hygienists and see if you can get taught how to do home enemas or how to do colon hygiene in a colon hygiene office, which is sanitary and has disposable and highly cleansed and sanitized speculum and devices and hoses and all the different things that are used for that. It's very comfortable. It's very modest. You're covered by a blanket. It's very modest. You're not exposed to the world. You can have a conversation with your colon hygienist. They can massage your abdomen. They can work with you to roll you in different positions. And sometimes this is a very, very, very useful thing for reducing anxiety through stimulation of the parasympathetic nervous system. And of course, you've got to consider neurofeedback. Neurofeedback is really important. Chiropractic is very important for all of the mental illnesses. Chiropractic was a very instrumental part of all of the mental illnesses in the United States from before the turn of the century, 1900, until around the 1930s and 40s when a lot of the chiropractic hospitals ended. I think the last chiropractic hospital was in Colorado in the 60s, but there were chiropractic hospitals and chiropractic mental health institutions where they used chiropractic and natural hygiene and sunlight and diet and exercise. And they did this in California, they did this in Colorado, they did this in other states, in Iowa. And this is well documented, that mental health was treated through natural means. And in fact, judges would take young criminals and addicts and send them to sanitariums in the United States to do this chiropractic type of therapy, where they would get counseling and hygiene and diet and food and sunshine and all of that to recover from violent offenses and criminality and mental illness and all kinds of stuff. So please look at the history of this stuff. It's not to be scoffed at. Don't forget passionflower. The herb passionflower is very useful. Zinc lozenges are very useful. And please talk to your doctor, and please consider getting lab tests and brain scans and science-based work if you have anxiety and you've had trouble getting it helped with counseling or with medication. But don't abandon your prescriber or your counselor, because often you'll find that medications and counseling work much better after a person has done all of this biochemical work on themselves. Thank you.